Joining us on the phone today is Zack Pace, Senior Vice President of Benefit Consulting with CBIZ. Hey, Zack, good morning.
Good morning, Doug and Andrew. How are you?
We're great. How you doing?
I'm doing great, thanks.
Yeah, it was great to see you in Baltimore, and appreciate you being on today.
Oh, yeah, you bet. Yeah, it was a great conference.
Give our audience, I think a lot of people know CBIZ, but give our audience a little bit of background on CBIZ, if you would, please.
Sure. CBIZ is a national provider of business services. We do a lot of accounting, tax work, compensation consulting. I'm in the benefits practice. We also do payroll administration. Really a lot of different business services we're able to wrap together for clients. Within the benefits practice, my focus, as you mentioned, is most of my clients have between about 75 and 2,000 employees. Is where we're focused, which some would argue is the mid-market or so. Working a lot with employers and helping them map out a roadmap on the Affordable Care Act while still making sure that the benefit plans and the offerings make sense, the technology's in place. And really at the end of the day, they're able to attract and retain the talent they need to outperform their competitors.
Yeah, I appreciate that, Zack, and I think that mid-market is a market that needs a lot of help and are the ones that are leaning forward and accepting that help and saying, hey, how do we lower the healthcare spend? How do we keep our administrative costs reasonably? How do we stay in compliance? And how do we provide, cost-effective and quality benefit choices to our employees, right?
Sure.
Yeah. Hey, Zack, you got an interesting topic today that I'm anxious to get into because I think, as we look at this market and from your client's perspective, and your advisory capacity, you're trying to help employers save money the way they can and yet, continue to provide those quality benefits. And talk to us a little bit about health plans and spousal exclusions. What are the challenges and what are the emerging solutions?
Right. So what we've seen over the last decade or so is a growing movement where employers that are sponsoring health plans are looking at the cost of the health plan and specifically looking at the cost of what it takes to provide coverage to the spouses and the children, and are often noting when you look at the data that the claims for the spouses for each spouse is more than the claims usually for each employee. So the question is then, well, why are we offering coverage to spouses, and is there a way to reduce the ranks? And the tool that is growing in popularity, only about 10% of employers have done it so far, is to say, okay, we're going to offer coverage to spouses, but if the spouse has access to coverage at their own employer, they won't be eligible. Mm-hmm. And that's opening up some challenges to employers that they may not have considered. And what we're trying to do with our clients is just walk them through the pros and cons of that exclusion policy and look to see if there's a better way to encourage spouses to migrate off the plan versus having employees have to complete affidavits and such.
Jack, what are the pros and cons of an exclusion policy?
Well, the pro is it reduces costs, right? Because essentially you're saying all spouses that are working and have access to employer coverage are no longer eligible. So it's a pretty effective way to push those spouses off the plan and reduce all of the costs related to those spouses. The cons are there's no way for an employer that I know of to look on the public record and establish if a spouse, first of all, is employed, and two, has access to employer-sponsored coverage. So the only real way to figure out if they do is to make the employee attest to it via an affidavit. And, as you all know, anytime you have an employee sign an affidavit, it's burdensome, it's cumbersome, and, honest mistakes can be made that can have some severe personnel repercussions down the line, which can put employers in a real bind, especially if a key employee makes a mistake on an affidavit. So that's a big challenge. The other challenge is when employers stop and think about it, usually the if you look at their highly compensated employees and their officers, those folks tend to have a higher prevalence of spouses that aren't working than are the non-highly compensated or the core staff. So essentially, if you put an other employer spousal exclusion policy in place, what happens is you're essentially increasing the total compensation for the officers and the highly compensated and lowering it for the non-highly compensated, which can be difficult to explain why that's equitable.
Yeah, you make a very valid point. I had really zeroed in on is that, it's up to the employee to attest to whether their spouse is on another plan or not. There's no other way to find that out, right?
Not that I know of. I mean, there would have to be some kind of public record to look that data up, and I'm not aware of one.
So let me ask kind of a common sense kind of question. You got a working couple, and ABC couple is working for, let's say, you, an employer, and you get that affidavit, and they simply say, well, my spouse already excluded me. Is that
excluded the spouse, right? Well, so the question is, what do you do then?
Yeah. I mean, you can't do anything, right? You're just not going to be able to exclude them, right? Because you're not going to cover them. I mean, yeah. Maybe I'm answering my own
essentially what's going to happen is that's going to lead to...
It's ripe for confusion.
Yeah, it is.
Yeah.
And that's
right.
what you're saying, Zach. This is ripe for confusion. So how many employers are doing this right now?
Well,
your employers.
if you look at national statistics, about 10% are. It's weighted. It's higher for more jumbo-sized companies, and it's lower for smaller businesses. But of my 30 or so clients that I consult with, after we've kind of walked through all of this, none of them have implemented these policies when they've considered the administrative burden and the repercussions. And really, I'm an economics major, so I've always got Adam Smith sitting on my shoulder yelling at me. So to me, it's like if we've got working spouses that have access to coverage on our plan, we have lots of them, it's a symptom of a problem. And the symptom is we're not charging enough for spousal coverage. And that's easily fixed. Because all we need to do, really, is charge more. Once you isolate the cost of spousal coverage, charge more for that than what the average employee would pay for single coverage at their own employer.
Yeah, that seems to make a lot of sense. Then the couple is going to decide what they need to do to the economic benefit of that family, right?
Right. And then you let economics gently lead the person off the plan that makes sense for them. I mean, obviously, if you're charging $20 for employee plus spouse coverage a month, every single spouse is going to join the plan. But if you create the right kind of separation, then most of them, some will say, well, I'm willing to pay an extra $50 a month so we have coverage together. But most people aren't going to be willing to pay more, pay a lot more per month just for the convenience of having one plan.
Zach, talk a little bit about, when you look at the ACA and the ACA Act, I mean, it will permit, if I understand it right, it will permit employers to simply drop spousal coverage regardless of if the spouse has access to coverage elsewhere, correct?
Right. What's funny about that, Doug, is, that's been the case for the last 50 years, that you didn't have to cover spouses. But what's interesting about, you talk about consumerism and supply and demand, is when you give a consumer a choice or tell them something that go on record and say this is a choice, then it's looked at differently. So I think a lot of people were surprised when the Affordable Care Act came out and said, regarding employer share responsibility, that you don't need to cover spouses at all. And a lot of employers hadn't looked at it through that lens before of I really never had to cover these spouses. Why am I doing that? So another way to look at, some people are looking at it in a different way, which is I'm not only going to exclude the spouses that have access to other coverage, I'm going to exclude all spouses, period, which most would argue is a more equitable stance than picking and choosing which spouses you're going to exclude.
So are you finding some of your clients moving in that direction?
No, none are even close to looking at that, primarily because, I mean, at the end of the day, employers share responsibility, penalties aside. The main reason why employers continue to offer health coverage is to attract and retain employees. And if you go to an employee where they've built their financial plan and their lifestyle around their spouse not working, and you tell the employee that, well, we're not going to cover the spouse anymore, it's a problem. So people are looking at this and saying, if my competitors start doing this, maybe I will, but until then, I can't be competitive if I exclude all spouses from my plan.
So Zack, on this issue, and I'd like to move on to something else and just pick your brain a little bit. So on this spousal includes policy, I think your clear message is, it's a lot more complicated than simply a simple, line cut to cut costs. It's a lot more complicated than that.
Right. It can be a useful tool, but it really should never be the first tool considered. Right. Let's look at what we're charging the employees. Let's try to isolate the tiers, maybe make some adjustments in what tiers we're using so we can isolate the cost of spousal coverage and then increase what we're charging to an equitable amount. And maybe, 9 times out of 10, that's going to solve the problem. So what I get concerned about is employers looking at trends and studies and seeing the prevalence grow of this tool, and then thinking that, well, that should be the tool we consider without really getting to the weeds and the repercussions of what may happen.
Hey Zack, I'd like to pick your brains. We had about a couple minutes ago. I'd like to get kind of a minute or so. Give me your perspective on the Cadillac tax and your clients.
That's a pretty big question.
That's good, Zack. I like that.
Like how I'm thinking about it and what I'm talking to clients about. Is that kind of what you mean?
Yeah. Yes, please.
Yeah. So the way I've been thinking about this for some time is, I live here on the East Coast and I keep a sailboat on the Chesapeake Bay, and so all during hurricane season, I'm looking at the weather maps and saying, what kind of hurricanes are spinning off of the West African coast, and what do we be thinking about here? And so I've been treating the Cadillac tax really the same way since 2010. Of here's this huge storm that's brewing, and if this thing makes landfall, it's going to wipe out a city. So now we're getting closer and closer to this. Really, what I don't see a lot of folks talking about is, as it stands, I mean, what we know, what seems clear from Treasury is that, a lot of clients, a lot of employers in the mid-market, they don't have calendar year plans. So their plan might begin July 1, May 1, September 1. And as it stands, the Cadillac tax is going to start on January 1, 2018. So if I've got a March 1 plan, I don't have a whole lot of time left because I've essentially got to make final adjustments March 1 of 2017. So that's a message I think needs to get out there because that's coming right, essentially a year from now they'll have to be finished with this. What I'm talking to clients about is if this storm, and we've got two notices coming out of Treasury, neither are guidance, but both are suggesting that FSA contributions are going to count and pre-tax contributions that HSAs made either by the employer or the employee is going to count. So that's a low-hanging. Then those are going to have to go. So the question is, when do you start talking to employees about, hey, come the 2017 plan year or the 2018 plan year, depending if the plan's calendar year, we're probably going to have to get rid of this FSA, and the HSA is probably going to have to shift to after-tax dollars, and you would just take the deduction under Form 1040. Yeah. So that's what we're looking at. We're trying to make sure. Go ahead.
No, I think you're right. I think that's the fear that the Cadillac tax will kill FSAs, and simply it'll kill them, and it will dramatically impact HSAs. I mean, you can always use after-tax dollars, of course, but it will impact FSAs. Do you think there's a lot of lobbying forces going to work on those two issues, and a lot of people think there's a pretty fair chance that we can get at least those amendments done. What do you and the team at CBIZ, what's your current thoughts around that? What do you guys see happening?
I'm not sure CBIZ has a crystal ball on this either.
Right.
We're reading a lot of the reports coming out of DC, and I was reading an interesting article in Business Insurance this week where we're citing all this bipartisan support to repeal, but they're still saying that, well, we don't have the votes in the Senate and the president would surely veto it. So I think if you're an employer, what I'm suggesting is let's plan on this. This is going to happen. So let's model this out. Let's make let's look at the low-hanging fruit. Another would be making sure the dental and vision plans are HIPAA portability accepted. But let's not make any rash changes until we have to.
Yeah.
So
makes a lot of sense.
Same way as when a hurricane comes up to Chesapeake Bay, or it looks like it's coming here. You pull the sailboat out when it gets close, not 4 days before.
Yeah, I agree. Hey, Zach, it's great having you on the program. Look forward to doing it again sometime soon. Really enjoyed having you. Look forward to seeing you at one of our events coming up, and you have a great weekend.
You too. Thanks so much, Doug and Andrew.